As a heart surgeon with decades of experience, I've seen thousands of senior patients walk into my office worried about chest discomfort, breathlessness, or sudden fatigue. And often the cause isn't just diet or stress. It's a medication they've been taking for years, sometimes even prescribed to help another condition. What many seniors don't know is that some common pills taken daily by millions over 60 can quietly damage the heart muscle, increase blood pressure, or trigger irregular rhythms. These pills don't always show side effects right away, but over time they can weaken your heart and shorten your life. In today's video, I'll reveal the 7 most dangerous pills that may be harming your heart health without you even realizing it. This is not about fear. It's about awareness. If you or someone you love is over 60 and taking medications for pain, sleep, blood sugar, or mood, you need to watch this till the very end. Pill number 1 is the most harmful and the most commonly used. I am not asking you to stop anything without medical guidance, but you deserve to know the truth. Jim's first clue was his daily ibuprofen for arthritis pain. He'd been taking it for years, thinking it was safe. That brings us to our first risky medication, nonsteroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and naproxen. These are go-to pills for joint pain, backaches, or arthritis, especially for seniors. But here's the catch: NSAIDs can raise your blood pressure and cause fluid retention, putting extra strain on your heart. For an aging heart, this added pressure can lead to heart failure or irregular rhythms. Jim noticed his ankles swelling, but he blamed it on age, not his pills. If you're taking NSAIDs and have high blood pressure or heart issues, they can interfere with your heart medications, making things worse. My neighbor Clara, 68, switched to physical therapy for her knee pain after learning this, and her swelling eased up. If you rely on these painkillers, talk to your doctor about safer options like heat therapy or gentle stretches. Jim's pain relief came at a cost, but another pill was troubling him too. Jim was also managing his type 2 diabetes with a medication his doctor prescribed years ago. That's our second risky pill, certain diabetes drugs called thiazolidinediones, like pioglitazone. These lower blood sugar, but they can cause fluid buildup, leading to swollen legs or even congestive heart failure, especially in seniors over 60. Since many folks with diabetes already face heart disease risk, adding a drug that stresses the heart is dangerous. Jim thought his tiredness was just diabetes, but his swelling hinted at heart trouble. If you have a heart history or notice puffiness, this drug could be worsening things. My friend George, 65, asked his doctor for a different diabetes med after learning this, and his energy improved. Always ask about safer alternatives, like metformin, and monitor for swelling. Jim's diabetes pill wasn't the only issue. His sleep troubles led to another risky medication. Jim struggled to sleep, so he took a sleeping pill every night. That's our third risky medication, sedative hypnotics, like zolpidem or diazepam. These promise restful sleep but slow your heart rate and nervous system, reducing your body's ability to handle stress or oxygen needs at night. They can cause or worsen sleep apnea, where breathing stops briefly, putting huge strain on your heart. These pills also clash with heart meds like beta blockers, making them less effective. Jim was also managing his anxiety with an older medication prescribed decades ago. That's our fourth risky medication, tricyclic antidepressants, like amitriptyline or nortriptyline. These older drugs treat depression, anxiety, or chronic pain, but they pose serious heart risks for seniors over 60. They can cause irregular heartbeats, blood pressure swings, or even a dangerous condition called heart block, where electrical signals in the heart misfire. Jim felt lightheaded during walks, but he didn't connect it to his pills. These drugs are riskier with age, and even low doses can harm if not monitored. My friend Betty, 67, switched to a newer antidepressant after noticing heart flutters, and her energy returned. If you're on these, don't ignore tiredness or dizziness. Ask your doctor about safer options like SSRIs. Jim often reached for cold medicine during allergy season. That's our fifth risky medication, decongestants, like pseudoephedrine or phenylephrine, found in over-the-counter cold and allergy drugs. These shrink nasal passages by narrowing blood vessels, but they also tighten vessels throughout your body, including those feeding your heart. This spikes blood pressure and makes your heart work harder, which is risky for seniors with high blood pressure or heart disease. Jim felt jittery after taking them, but he thought it was just a cold. Many assume these are safe because they're over the counter, but age changes how your body reacts. My neighbor Frank, 69, switched to saline nasal sprays for his sinuses, and his heart felt steadier. Always read labels and ask your doctor before using decongestants, especially if you feel anxious or dizzy. Jim took a heartburn pill every morning, thinking it was harmless. That's our sixth risky medication, proton pump inhibitors, or PPIs, like omeprazole or pantoprazole. These treat acid reflux, but long-term use can harm your heart. PPIs reduce stomach acid, which blocks absorption of magnesium, a nutrient vital for heart rhythm. Low magnesium can cause fatigue, muscle weakness, or irregular heartbeats. Jim felt sluggish but didn't link it to his reflux pill. If you're on PPIs for weeks or months, it's time to reassess. My friend Clara, 66, worked with her doctor to cut back on PPIs by eating smaller meals, and her energy improved. Don't mask heartburn, find its root cause with your doctor. Jim's reflux relief was risky, but there's one more pill we need to talk about, and it's a big one for seniors like him. Jim was taking a blood pressure medication prescribed years ago, trusting it to keep his heart safe. That's our seventh risky medication, certain calcium channel blockers, like verapamil or diltiazem. These are used for high blood pressure, chest pain, or arrhythmias, but older versions can slow the heart too much, especially in seniors with reduced heart function. This can cause dangerously low heart rates, dizziness, or fainting. Jim felt faint during yard work, but he blamed it on age, not his pills. Without regular monitoring, side effects are often mistaken for aging. Never stop these drugs on your own, but ask your doctor about safer options, like amlodipine, and watch for fatigue or slow pulse. Jim's heart medication was a surprise, but tools and awareness helped him take control. That brings us to a powerful way to stay proactive, tools like the Senior Health Tracker app. Jim started using it to log his medications, track symptoms like swelling or dizziness, and catch early warning signs. Unlike most apps, this one's designed for seniors, making it easy to monitor your heart health and share data with your doctor. The app's in high demand, so grab it while access is open. My neighbor Linda, 68, uses it to remind her about meds, and it's given her peace of mind. Check your pill bottles and note any symptoms like tiredness, swelling, or jitters. Then, call your doctor to review your meds. Don't stop anything on your own, but ask about safer options. If you notice heartburn, try smaller meals. For pain, try stretches. For sleep, try a warm bath. Share your plan in the comments. If you felt heart flutters or breathlessness, don't wait, get checked. As a heart surgeon, I've seen too many seniors hospitalized because of medication side effects, not illness. You deserve to live long and strong, and it starts with asking questions. Give this video a thumbs up, share it with a friend, and subscribe for more tips to thrive after 60. Download the Senior Health Tracker, talk to your doctor, and keep your heart strong. See you next time.